I'm Ashley Palmer, athletic trainer here at Grand Itasca, lead athletic trainer at Grand Rapids High School. We are available every day in the schools, after school, and to most of our games on the sidelines. Our contact sports take priority, but we usually are at swimming, some tennis matches, all of your football games. We travel on the road as well. So they can come in after school, get their taping, treatment, rehab, whatever they need, go to practice. After we're there, icing, whatever needs to be done, and then pre-game as well, so they can have taping or whatever they need before they play. All the sports vary a little bit, but obviously concussions is always a hot topic. Luckily, I do not see the amount of them that people probably assume that I see. I would say I have 1 or 2 a sport a season at max usually. You're gonna see a lot of ankle sprains. You can see some knee sprains. Hockey, you're more contact. Lacrosse, football, you get a little more shoulder, AC joint stuff going on. But a lot of it's fairly minor stuff that we can deal with right there on the sideline or in the athletic training room and kind of take care of and get them back to playing. So I carry quite a bit of equipment with me on the sidelines, and for a lot of my games, Dr. DeGraio is also there. So we can evaluate the injury, decide what our best course of treatment is, whether we can tape or do something and get them back into the game that night, or if we need to have them sit. Worst case scenario, they're going to see Dr. DeGraio in clinic the next day or within the next couple of days. But there's a lot of stuff that we can do that takes care of our minor injuries and keep them playing safely. Some of the more major stuff, we hope we're not calling 911 for, but we're prepared to do that if needed. We have a great relationship between us and Dr. DeGraio and kind of our sports medicine rehab physical therapists. It's really easy to communicate and work with them, and we'll move athletes between doctor to physical therapist to me, because there's a lot of stuff we can't do. Say they're doing rehab here in the clinic that's sport specific. If it's running, there's not a lot of space in the clinic, so I can work one-on-one with the athlete and the therapist and have them running off-site, and then getting back to Dr. DeGraio and communicating, hey, here's where we're at, this is what we need to do, this athlete's doing better than expected, or hey, maybe we need to bump up and get a little more aggressive with their treatments. So we have a great relationship. It's really easy to work amongst our staff and kind of get whatever each athlete needs to help them return to their sport. Some of the best ways athletes can prevent injuries on game day or practices are to come into the season in shape. The more in shape you are and the more you've been doing, the less chance you have that you're going to be injured, because a lot of the stuff we see are non-contact injuries. It's a hamstring strain or a quad strain or an ankle sprain. So if you've been lifting and running and working out and things like that, your body's kind of built up and it's less likely to see those types of injuries. But being safe within their sport, making sure you're following proper techniques, wearing the right type of helmets or equipment. If you are feeling some type of small injury, have it looked at right away. Come see us. We can, make tweaks to modify whatever you're doing and make sure that we're not getting worse. Lots of sleep. Kids probably aren't getting the sleep that they need. Nutrition and hydration. There's a lot of stuff that you can be doing, whether it's equipment or what you're eating, drinking, and what type of conditioning you're coming in to the season as. So we already provide coverage for Grand Rapids High School, all of our events there. We have now expanded. We're going to be doing Greenway High School, all of their events. We also do the Itasca Community College, and we cover Hill City's sports. And then we do also do outreach for, section games and things like that, playoff season, Deer River, Nashwauk. We're kind of open to anybody in the community who needs anything. Grand Itasca Clinic and Hospital, your health is our specialty.